Hello everybody, I'm Hamza Sheikh. I'm one of the consultants in Gloucester Royal Hospital and training lead for ultrasound in the Severn Deanery. This is just an intro about echo and light support, mainly about probe selection and the orientation of the probe. So the probe of choice is the phased array probe, commonly known as the cardiac probe. And thing to note here is the probe marker, which basically, if you're starting off with depending on the view, so if you're starting off with the long axis view, it's going to be towards the patient's right shoulder. Then you move on to the short axis, it moves 90 degrees towards the left shoulder. For the apical 4-chamber view, it is again directed towards the left shoulder but towards the apex. And the subcostal view is, of course, in the subcostal region with the probe marker towards the patient's left. Now, if you see this phased array probe or cardiac probe, the orientation on the screen is basically, if I change the preset now, focus cardiac, if you see that marker, it moves on to the right of the screen, whereas if we have the other probe, which I'll show you in a bit, it is on the other side of the screen. And moving on to scanning the aorta, the probe of choice is the curvilinear probe, and this is the probe marker. And just a bit of intro on that, you are going to be placing the patient in, if you're doing a transverse, the probe marker is going to be pointing towards the patient's right. If you are doing it in longitudinal, then it has to be oriented towards the patient's head. And as you can see on the screen, once I've changed it to the abdominal or the fast preset, the marker on the screen goes on to the other side. That's why we have slightly difference in orientation, and that has something to be taken care of. Of course, that would depend from machine to machine that you're using. But nowadays, most of the machines are coming with this default setting, and that's how we take it.